Hi everyone, welcome to Dental Shots. Today we are going to see part 7 of Cementum series concentrating on non-collagenous proteins of cementum. Bone protein, fibronectin, osteocalcin, osteonectin, osteopontin and tenacin contribute to the non-collagenous protein. Let's see one by one. First is the BSP, bone protein, which is the phosphoglycoprotein. It's a member of transforming growth factor beta superfamily, has 20% of sialic acid residues, and the cementoblasts appear to secrete BSP. The BSP act through transmembrane serine threonine proteins. BSP 2, 4 and 7 promote the differentiation of putative cementoblast precursor cells. The BSP is associated with the early matrix mineralization during early stages of cementogenesis. It also acts as an attachment factor, hence it has an affinity to the collagen fibers and enhances the attachment of osteoblast and fibroblast. BSP is also used in periodontal regeneration, marks the late stages of osteoblast differentiation. It promotes the mineral formation on the root surface and involved in the cellular events through their RGD cell binding motifs. The next non-collagenous protein of cementum is the osteocalcin, also known as bone gla proteins, contains the carboxyglutamic acid, gamma carboxyglutamic acid, a very small protein involved in the mineralization. This osteocalcin is a marker of cell associated with mineralization. Osteocalcin has a significant role in preventing the ectopic calcification, and it also a significant indicator of osteoblastic differentiation, and also plays an important role in regulation of crystal growth during mineralization. The next non-collagenous protein in the cementum is osteonectin, which is an acid phosphatase, as glycoprotein, which is rich in cysteine. This osteonectin is found in PDO, particularly in the Sharpie's fibers at the attachment site. These are secreted by osteoblasts. It is mostly present in the bone and located mainly in the basal lamina. Involved in the regulation of differentiation and mineralization process, is a predictor of bone destruction. If you see an osteonectin, then it would be an important predictor of bone destruction. The next non-collagenous protein in the cementum is osteopontin, which is also termed as BSP1. It has a high sialic acid content in the glycoprotein and primarily found in the bone and has an affinity for calcium ions. So, the BSP and osteopontin are the predominant non-collagenous protein in the cementum. It is involved in the pre-cementoblast chemoattraction and its adhesion to the root surface and cell differentiation. Osteopontin acts as a adhesion protein associated with the acellular cementum. It is expressed prior to the mineralization, and it appears to be involved in the attachment as well as the movement of osteoblast and osteoclast. Osteopontin is regulating the mineral growth. When there is an osteopontin knockout mice, there is no anomaly in the root development because of the compensation made by the other non-collagenous protein of the cementum. The next non-collagenous protein is a fibronectin. It has an important in the diagnostic and therapeutic application in periodontics. It has an important role in the formation of the long junctional epithelium and used as in the root conditioning agent. It is involved in the organization of the extracellular matrix. Fibronectin is a potential marker of disease activity. Alpha-5 beta-1 receptor mediates the fibroblast adhesion to the extracellular matrix in the gingiva and periodontal ligament. The fibronectin binds with the cells to the components of extracellular matrix. During the tooth development, the fibronectin and tenacin, which is present in the basement membrane of the Hertwig's epithelial root sheath at the time of odontoblast differentiation. And it is also found in the attachment site of the pedicle to the cementum surface, but not in the cementum itself. The next non-collagenous protein is the tenacin, which is the large molecular weight proteoglycan containing a large chain glycosaminoglycan, is seen in pedicle and in cemental surfaces. The tenacin comprises of the family of proteins that has been designated as tenacin C, R, X and Y. Tenascin is widely distributed in periodontal tissues, has a key role in linking the collagen to the mineralized matrix. Tenascin is an expression which is found significantly increased when the tooth is subjected to the mechanical load. So the importance of non-collagenous protein, that is the bone xyloprotein, osteopointin, osteonectin, which is expressed during the early tooth root development by the cells along the root surface. It plays an important role in the differentiation of cementoblast, which is the progenitor cells of cementum. I hope this would be a detailed explanation of the non-collagenous protein of the cementum. And do not miss to see a protein which is specific to the cementum in the part 8 of cementum series. Thank you. Have a great day. God bless you all.